the game screen at the top of my lungs. I don't know what's wrong with it, but anyway, just go for the last. Anyway, two divisions. The axial, which is just like the axis of the body, the skull, the vertebral column, and also the rib cage, the thoracic cage. So it's light and strong. It is actually really strong and fairly light, of course. And you can obviously, we know what's adapted for locomotion, protection, manipulation. And the two parts that you need to understand the difference between the axial and then everything which is kind of hanging off of it, your arms and legs, the appendicular skeleton. Now your book goes into a bit more detail than we need on these next two slides, but I'm going to show them anyway. This, I can't see the, you don't need to do the math here or anything like that, but the general number you always get is 206 bones in the skeletal system. You see it's broken down into 80 in the axial and 126 in the appendicular, but again, you don't need to know this. The axial skeleton, the skull, the ribs, the vertebral column, the sternum, that sort of stuff. So that's the axial skeleton. You would think, well, geez, wouldn't the ribs sort of kind of be maybe appendicular because they're hanging off of the axial skeleton? But no, they're actually considered part of the axial skeleton. You see the arms and the legs and the collarbone and all that sort of stuff. None of that's on there. So that's the axial skeleton. And okay, now some new stuff about the skull. If you count them up, there's 22 bones that make up our skull. And obviously, you know what the job of it is, to house and protect the brain. And the way the 22 comes around is the cranium has 8 bones, the ones you learned last night, the temporal, sphenoid, ethmoid, frontal, all those kinds of guys. And then 14 other bones, which are facial bones, like the zygomatic bone, the nasal bone, the lacrimal bone, and all that kind of stuff. So, and having studied that last night, this makes my job a little easier tonight because at least you know what these names are. Once again, you don't have to memorize the math on this sort of thing, but here's the general breakdown. This is the one I never talk about, the hyoid bone. This is the kind of oddball bone that's sort of the trivia question: what bone in the body is not connected to any other bones? It's the hyoid bone. It's in your kind of above your throat, kind of above your Adam's apple. It has the muscles of the tongue and stuff attached there, but we don't ever worry about that one. But anyway, so you can see the breakdown here between the 8 and the 24, and what the skull looks like. Okay, you got a couple of things here. I know you know these already. The sutures, you learned those last night. The lambdoid suture here, the sagittal suture there. Maybe this is actually a little better over here. And then the parietal bones, the occipital bone. One thing last night that there were a few questions on it, but I don't think too many of you had any trouble with it. Is this little structure right here, the external occipital protuberance, this little bump right back here in the back of our head, right back here. And many of the muscles which allow us to do this, things like that, well, you'll get it on our next unit, but the muscles which allow us to move our cranium are attached there. And this is often a little bigger in men than women, just because the muscles in men are bigger than women. This is kind of one of those landmarks that you can use to tell the sex of skeletal remains. Another thing, well, you'll see a better picture of it in a second, the styloid process, broken on many of our skulls, but it's, we have it on our skeletons. The mastoid process, that was an instrument behind your ear. So anyway, there's probably nothing on there that you had any difficult time finding on any of that stuff. The sutures are all pretty obvious. This is just another picture of the sutures, and here's the parietal bone, the occipital bone, the frontal bone, and once again the sutures. Actually, the last night in this unit we'll talk about the articulations in the body where bones come together. And the sutures in the skull are actually a type of a joint, even though they do not move. You often think about things, joints, things that are moving. But the sutures are actually joints. They just don't move, which doesn't make much sense, but nevertheless, they are considered joints. And they're just like little sewn together places where all the bones come together. All right, this is a good one. Now, all of these you're familiar with. This is a really good picture. Let's see, just to pick out a few that maybe we could talk about. Well, obviously, here's the styloid process. I've got that. There's the mastoid process. There's one thing I want to point out on this skull. This pink bone, this is kind of pink right here, the temporal bone, and how it's related to this blue bone, which is the zygomatic bone. That's bone right here, your cheeks. there's this little process is just an extension of bone, and it's got two different names. So the little process that's coming from the temporal bone, sort of going towards the zygomatic bone, is the zygomatic process of the temporal bone, and then the other one is just the opposite, the temporal process of the zygomatic bone. So it can be a little confusing, the terminology, but you want to get those two straight. Mastoid process, let's see, the sphenoid bone, sphenoid and the ethmoid, you know those now. But the sphenoid bone is an internal bone in the skull. And from the outside of the skull, all you can see is just this little area of the sphenoid. It's actually, if you studied the sphenoid last night, it's actually sort of the margins of the greater wings, where it sort of is external on the skull. So that's the sphenoid bone there. When you look at the eye socket, and this is not a good picture for it, they always, and it's true, one of the small bones which forms the orbit of the eye actually is the ethmoid bone. You can see it's in green. It's tucked way back in there behind the lacrimal bone. Yeah, it is, but I've never on an exam ever tried to get a piece of clay on it in the orbit of the eye and go, you know, what's that?